We're joined by Dr. Jeffrey Potter from UW Health. So again, we can call this a little bit of mask whiplash when it comes to mandates. And as we know, Milwaukee Public Schools, Whitefish Bay now implementing a mask mandate. What do we need to know right now, doctor, in terms of mask wearing?
Yeah, I think what we're really looking at is we are seeing cases increase. And our theory is that with the rate of vaccination and those who are boosted, combined with the number of people recently infected with Omicron, we may have enough residual immunity in the community that even though cases are going up, people are having symptoms, they're less likely to get severely ill, to make a run on hospitals, and reduce the ability of others to seek out healthcare resources. If that's true, then not having masks wouldn't be such a big deal, would mean more cases. But if we're wrong on that theory, and we do start to see an increase in hospitalizations, then we may wish that we kept some of these mask guidelines in place just a little bit longer.
So in terms of COVID cases, how high do you expect them to get? I mean, we've seen days over 1,000 cases, being reported.
Yeah, we won't know for sure. With the previous immunity in the community, that means some people who are exposed to COVID-19 are not going to get symptoms. I do think we'll see a spike, but I don't think it'll be anywhere close to the spike that we had back in January, February, where a good portion of the population was susceptible to the Omicron variant at this time. But to see a bit of a spike that kind of plateaus out before gradually falling sometime, early summer wouldn't be all that surprising. We just don't want to see hospitalizations follow that historic trend where they typically go up after cases go up.
Right. And the Wisconsin Department of Health is now doing the CDC community level metrics. Is that an easier way for families to stay up to date?
I think so. For most people in the community, that's the right metric to look at. And the reason that it's different is before we would look at cases per 100,000 people, and most of the metric or the color being driven by how many people had come down with COVID. This is a little bit different. It still looks at cases, but it also looks at, how many hospital beds are staffed, are hospitals getting overwhelmed, other metrics that go into how well a specific community can handle a surge in COVID cases. So I think for folks that are, not immunocompromised, looking at that metric and saying, this is how I'm going to make my decision to mask or not mask, how much, risk I'm going to accept is probably the right move.
And for those who are watching and joining us this morning, would you say if you're on the verge of wearing a mask or not wearing a mask, would you just out of safety, advise them to just wear it or bring it just in case?
The way I break it down is certainly if you're high risk, if you got COVID, things could turn out very poorly. With cases increasing, it's a really good idea to wear a mask. If you're not high risk, you're vaccinated, you might develop mild symptoms. I'd really look at, what am I trying to do? I might not get very sick, but, do I have time to be sick at all? Knowing that with cases increasing, going out in public unmasked, especially if there's a large group, there's a good chance you're going to be exposed, and that may result in some symptoms that might be undesirable just from, your personal way of life.
Right.
You might decide to wear a mask too, just to avoid getting sick.